you doing today, Mrs. Spray?
I'm doing fine. Yourself?
I'm doing well. I called you in today to go over your test results.
Okay, perfect.
So, we're going to practice this little exercise, okay?
Okay.
Hold your hand.
Okay.
Okay. I need you to breathe in and breathe out. How do you feel?
I'm doing fine.
Did that relax you a little bit?
Yeah, a little bit.
Shake it out. Okay. So, when I was looking over your test results, I noticed that you tested positive for one other thing,
Okay.
and that's HIV. Are you still good? Will you practice doing another exercise?
Nah, I'm good. I'm chilling.
Sure.
I feel good, man. Yeah, I'm chilling.
Okay, so HIV is not AIDS.
Okay.
Just get that understood. Do you accept the fact that you have HIV?
I mean, I'm still in awe, but I always knew it was possible, but I never really thought it was it could have a B type thing.
Okay.
I mean, how good is the test, like on percentage wise?
The test is pretty accurate, I must say. However, just like anything, errors happen. I mean, it's possible that your blood work could have got mixed up with someone else's. So if you wanted to be very, very certain, we can run your blood test again.
Okay.
But I do have the psychiatrist of my office here today with me, just to talk you through it, because it's very normal for you to experience denial right now. It's something huge and life-changing. So I'm just give her a moment to speak with you.
Okay.
How you feeling again, Mrs. Fernando?
All right. I mean, it could be better, but
Well, I mean, it's not the end of the world. You know what I'm saying?
I mean, it kind of is. I mean, to me, it is. I feel like, what can I do? Like, it's a wrap.
If it makes you feel any better, more than 1.1 million Americans have HIV, but only 1 out of 7 even know it. So at least you know, and you can take some, steps into treatment. I would say.
But I mean, treatment, like I heard like that the medicines, itself give you worse symptoms than actually just chilling with it, just letting it go, take its course. I don't know about the medicines, like, I don't know.
Well, I mean, I can still tell you some different medicine plans. Do you have insurance?
I don't really have insurance. Do you got anybody I can talk to, like an insurance rep or something?
I do.
Okay.
Her name is Paris. She's actually gonna come in right now and speak to you.
Dismarta, how are you doing today?
Could be better.
I'm sorry to hear about your results. I am the insurance provider of the doctor's office today. I'm going to be talking to you just so you know a little things about the ACDA, the American Affordable Act. We provide Americans with health security by putting in place insurance reforms and making sure that the coverage is expanded for you so that you could go to any hospital or any pharmacy that you need to get your medicines covered if they are expensive. I know they are expensive, but you are able to get some insurance that will lower the cost and get you some free medicine as well.
So like my thing is the symptoms, like the symptoms that the medicine does. Like, do you offer like medicine like that's like that doesn't require that? I mean, it's not required, but have that many symptoms. You know what I'm saying?
Well, you have your medicines that cover those symptoms. So if you have like nausea, vomiting, we'll have some more medicines for you. So it is a lengthy and a big amount of medicines you do have to take. And like I said, I know they're pricey and they're expensive, but that's why we have the insurances that do cover certain bills and whatnot for you, so you don't have to pay that hefty amount. And it does cover all the wide range of medicines for you.
Okay. I guess that's okay.
As the insurance rep stated, the process is very, very difficult and it takes a toll on your body. However, with the insurance, it doesn't cover everything due to, I'm going to introduce you to something called the iron triangle in healthcare. It's made up of 3 points: access, quality, and cost. So what the insurance does is it basically battles out the 3. So you'll have 2 winning while 1 is losing. So you either get a good quality medicine that doesn't cost as much, or you'll get a good quality medicine but won't always have access to it. One will always be lacking. So what Ms. Paris covered is basically saying that we're gonna do the best we can, get you as much coverage as possible, and if I look at your records, right, you're like financially stable, so it shouldn't be a problem. I don't understand why you're just not getting insurance, but that's for a later discussion. However, when you go into society, a lot of people will know that you have HIV, but you will know, so you'll like feel different from our people because there's certain things that you should know going in. Like if you get a cut, you shouldn't share it with the world because you can possibly spread your virus with other people if they have open cut as well. So right now I'm gonna just bring in a good friend of mine that's really close with the practice to basically hit on like some ethical issues that you might face dealing with HIV.
So I do want to just let you know also that everything is confidential. So I know it's a group of people here, but none of your information is going to escape this circle. For all of our licenses, of course, are in jeopardy, so to say. So as healthcare professionals, we do encounter many ethical issues, especially with dealing with such a serious cause, which we have here with the situation that we have with you involving HIV/AIDS. Such issues include, of course, getting resources for the disease. Also, basically the use of various methods for disease control, including mandatory testing, because of course you continue to get testing, forced isolation, and also informing your sexual partners that you've been with. You definitely want to get, if you can remember all of them, the ones that you use unprotected sex with, even a kiss, man, you want to definitely inform them that you had the disease. Like we have a psychiatrist, we know it's something hard for you, but we'll definitely, if you need help with, coming up with a way to, but that's something very important because we have to, of course, limit the transmission of that disease. So, as far as that, of course, we're also going to educate you on the disease because I know some people, they may think this is the end of the road for them, but actually now, in 2017, man, there are a lot of people living with the disease, and they're living far past their 50s, they're enjoying life, they're playing sports, they're doing everything that their peers are doing beside them. So, of course, we are going to educate you. We're going to also encourage you to stay healthy. Since you all were diagnosed today, we are going to begin HIV treatment as soon as possible. We're also going to start taking medicine to treat HIV. One of my associates already discussed with you that we're going to, of course, come up with a plan for you. So as far as your wages, what you're receiving, we'll see if we can get the government in to aid you, so we can help you with that, and just in case you need help with the medication. And yeah, man, we're gonna basically and just to inform you, the medicine that we have to offer is to help not totally rid you of the disease, but just to slow the progression of it, so it won't just take you out and all. So we'll just go ahead and like I said, look for resources so we can get you to start doing your life.
Appreciate it.
Not a problem, man.
All right. Appreciate you.
That's it. My name is Maurice, and basically my job in the project was to discuss the ethical issues. I was just making sure we sought justice and everything followed as procedure.
Hey you guys, my name is Paris Davis. I was the ACA rep, the insurance rep. I talked to our patient here about all the goodness about the insurance that covers those medicines that he may be worried about, just all-around coverage, and all that good jazz.
My name is Jonathan James. Unfortunately, I'm the one who was diagnosed with HIV. I was a little skeptical about the process of being affected and what to do about it. So I was asking these guys, what's the best route to take?
Well, my name is Janique Campbell. I was playing the psychiatrist. I was just basically here helping the patient here with his emotions and feelings in case he was, feeling denial or anything.
And greetings. I am Onyx. I play as the doctor, and I discuss the iron triangle for healthcare to talk this little thing here through the whole process.
And that was our project.
Cut! You can put that at the end.
For real, that was funny.